Hi everyone, this recording will serve as a supplemental material. This is going to be a short one as I will only highlight some details and give some side notes. So you have the freedom to pause the video at any point in time for as much as you want. Okay, so this video is for the lesson skeletal system. So let's start with the different functions. So one function of it is that it provides support, that is through its structure composed of bones, cartilages, and joints. With the joints leads to body movements because of its presence. So some of its components, okay, provides physical connection between bones known as your joints. Again, bone to bone through the joints and other body organs through the tendons. Another is that it protects internal organs. Okay, and then some processes occur in your skeletal system, and that includes your blood cell formation. Okay, so that occurs at the internal part of the bones, specifically in long bones. Another is that it stores essential materials. And lastly, anchors skeletal muscles. So this anchorage is very important during muscle contraction to produce different body movements. So your skeletal system is known as your dried up body. Why? Because your skeleton came from the Greek word and it means dried up body. So our internal framework is beautifully made and proportioned. Okay. So your skeletal system has divisions, which includes first axial skeleton and second appendicular skeleton. With the presence of the joints in your skeletal system, uh, your body is given the ability to be flexible and allow body movements. Okay, so here are some of the notes for the functions of the bones. Okay, it's for support. Okay, it serves as pillar. Okay, bones of the leg act as pillars supporting the body trunk when we stand. For the protection, okay, fused skull provides a snug closure to the brain. Okay, and with that, it allows activities such as for a soccer player, for its head or his head, uh, bump into a ball without worrying about injuring the brain. Another example of how the bones protect our body is through the vertebrae, which surround the spinal cord. So without the vertebrae, the spinal cord may have frequently be subject into injury. Another is the rib cage. Rib cage helps protect the vital organs of the thorax. Okay, so another function is bones allow movement. So as a result of allowing body movement, we are able to breathe, walk, swim, and throw a ball. Next is that it has the ability to store um, substances. For example, fats are stored in the internal cavities of the bones, known as marrow. Okay. Example of minerals that are stored are your phosphorus and calcium. Your calcium are stored as calcium salts, And small amounts of calcium in its ion form must be present in the blood. And that form is in this form, that. Okay? So calcium's role in the blood is that it plays a role for the nervous system to transmit messages, for muscles to contract, and for blood to clot. So imagine if calcium is not stored properly, those three minimum functions of calcium in the body won't happen. So the normal range of blood calcium level is 8.6 to 10.3 milligram per deciliter. That is according to the UCLA, or University of California, Los Angeles. So some problems may occur with the level of calcium in the blood. Okay, if the level of calcium in the blood is too high, that is known as your hypercalcemia. And if it's too low, it is known as your hypocalcemia. So, what is the mechanism by which the calcium is increased and decreased in level in the blood? That is through deposits and through withdrawals. Okay, so if the calcium level in the blood is too low, there will be withdrawal of calcium deposits. Okay, while if there is too high calcium level in the blood, the calcium or excess calcium will be deposited. Another function is the formation of blood cell, also known as hematopoiesis. Okay, it is a process which occurs within the marrow cavities of certain bones. Okay, so we have classification of bones, and in this slide are its characteristics. So the adult skeleton is composed of 206 bones. There are two types of bones, or osseous tissue. So bones are also known as osseous tissue. So in terms of size and shape, they come in different form. It can be as small as pisiform wrist bone as compared to a long thigh bone, or femur. So femur or thigh bone can be as long as 2 feet. So let's have the classification of bones according to shape. So you have four classifications according to shape, and here are their characteristics. So for the long bones are composed of spongy bones at the ends. For flat bones, two thin layers of compact bone are sandwiching a layer of spongy bone between them. An example of these flat bones are your sternum, or also known as your breastbone. Short bones, they have outer layer of compact bone, an example of which includes your ankle. Okay, so short bones can be classified as your sesamoid bone. Sesamoid bone are special type of bones which form within the tendon, like your patella. Last classification is your irregular bone, or bones that do not fit the first three are termed as your irregular bones. Now let's have your long bones here uh, in its gross anatomy. So your long bones are composed of your diaphysis, epiphysis, and epiphyseal line. The diaphysis is protected by fibrous connective tissue known as your periosteum. They are secured to the underlying bone by hundreds of connective tissue fiber, known as your perforating fibers or Sharpie's fiber. Second, you have your epiphysis. It is covered by articular cartilage. Your articular cartilage is a glassy hyaline cartilage. Glassy, yung glass, which provides a smooth surface in order to decrease friction when covered by lubricating fluid. So epiphysis is the one which decreases friction. What is epiphyseal plate? Epiphyseal plate, a flat plate of hyaline cartilage. So this anatomical feature of long bones are seen in young growing bones. It is responsible in the lengthwise growth of a long bone. At the end of puberty, okay, hormone inhibits the growth of long bones, and that is inhibited through your epiphyseal line because it is also the part of your long bones where growth occurs. Your epiphyseal line, okay, when became mature, okay, or after its growth, becomes the epiphyseal plate and becomes bone later on. So we have here some features of the long bones. For the medullary cavity, okay, your medullary cavity is the red marrow storage in infants until the age of 6 or 7. Okay, the red marrow produces the blood cells, but we also have your yellow marrow made up of your uh, or makes up the fat cells. So in adults, the red marrow is confirmed in the cavities in the spongy bone of axial skeleton, such as in hip bones and epiphysis of long bones. You have your humerus and femur. Next, bone markings. So bone markings, okay, are markings where um, it is classified according to categories. The categories include your projections, or also known as processes, and another category is depression, also known as cavities or indentations in the bone. So, for these categories, um, terms that starts with letter T are usually projections, and terms starting off with letter F are usually depressions, except for the bone marking facets. So these bone markings are very important because muscles, tendons, ligaments are attached to these bone markings and where blood vessels and nerves passes through. So here is the microscopic anatomy of your bones. Left hand are the parts of the bones, and we have these terminologies. First, the osteocytes, they are known as the mature bone cells. They are found within the bone matrix in tiny cavities. Next is your lacunae. These are arranged in concentric circles known as your lamellae. Lamellae, these are arranged around central canals, also known as your Haversian canals. So they run lengthwise through the bony matrix, and they house or carry nerves and blood vessels to all bone areas. Next term we have here is osteon. Okay, so each complex consists of central canal and matrix rings, and they are called your osteons. Okay. And the last term we have here is your haversion system or the osteon itself. So osteon or haversion system is the structural and functional unit of compact bone. We also have the canaliculi. These are tiny canals that radiate from central canal to all lacunae. They form a transportation system connecting all bone cells to the nutrient supply and waste removal services through the hard bone matrix. So, because of this elaborate network of canals, bone cells are well nourished in spite of hardness of the matrix, and bone injuries heal quickly. Next, you have your perforating canals, or also known as Volkmann's canals. They provide communication pathway from the outside to the interior of the central canals. So these Volkmann's canals or perforating canals run at right angles to the shaft or diaphysis and the central canals. So some facts about your bones. So in bullets, your bones are the hardest material in your body, but they are still lightweight. So their main function is that bones resist tension and other forces. They are strong yet simple body support system which allows mobility. So, what gives the bone its hardness? So, what makes it hard? So, one is due to the calcium. So, calcium gives bone the ability to resist compression. And also, its hardness also comes from organic parts. So, specifically, collagen fibers. So, it provides flexibility of bones and great tensile strength. When we say tensile strength, ability to be stretched without breaking. So there are two parts of the skeleton. You have your axial and appendicular skeletons. Okay, so your girdle attaches the limbs into the axial skeleton. Okay, so your axial skeleton are formed by two sets of bones, your cranium and facial bones. Okay, also your axial skeleton forms a cradle for the eyes that has an anterior opening. So, with the help of facial muscles, it allows us to show our feelings through smiles or frowns. Skulls are joined together by what? By sutures. Okay. And then lastly, we have the mandible. Except the mandible, which is also known as jawbone, which is joined with the skull through a freely movable joints. So in skull bones are joined together by sutures except for mandible. So in your cranium, all are single bones except the following. First, your parietal bone and your temporal bone. They are paired bones. Your frontal bone forms the following. You can just read these slides through your handouts. Okay, let's go with the temporal bone of the cranium. Okay, your temporal bone are attached to another bone through your squamous suture. So your temporal meets parietal bone at these sutures. Okay, for bone markings, your external acoustic meatus, it is the canal that leads to the eardrum and the middle ear. So it is the route where sounds enter the ears. Next is your styloid process. It is a sharp, needle-like projection. It is inferior to the external auditory meatus and used by many neck muscles as an attachment point. Next, you have your zygomatic process. It is a thin bridge of bone joining the cheekbone, or also known as your zygomatic bone. Mastoid process. It is a full of air cavities known as your mastoid sinuses. It is a rough projection, posterior and inferior to the external acoustic meatus. It is an attachment site for some muscles of the neck. Now, in your temporal bone, a condition known as your mastoiditis can occur. Okay, so what is this? So your mastoid process is located near at the middle ear. Okay, so in your middle ear, because of its location, the mastoid process has high risk spot for infections, and that is known as your mastoiditis. So the area is near the brain, and the problem there is that it can spread the infection to the brain. So that's very dangerous. Next is your jugular foramen, a bone marking in your temporal bone. So this foramen is found at the junction of the occipital and temporal bones, allowing passage of the jugular vein. Jugular vein is the largest vein of the head and drains blood from the brain. Next, we also have the internal acoustic meatus. So it is the anterior of the jugular foramen in the cranial cavity. So it transmits cranial nerves 7 and 8. What is cranial number 7? Cranial number 7 is facial nerve, and cranial number 8 is your vestibulocochlear nerve. We also have the carotid canal. Carotid canal is at anterior to the jugular foramen on the skull's inferior aspect. So carotid canal is where the internal carotid artery runs through, which supplies the most blood to the brain. Occipital bone. So your occipital bone and parietal bone meets or is joined anteriorly by the suture known as your lambdoid suture. We also have your foramen magnum. It is a large opening in the base of the occipital bone, and that makes it a large bone. Foramen magnum. Next is your occipital condyles. On each side of the foramen magnum, it rests on the first vertebra of the occipital condyle. Again, at the first vertebra. Okay, so in this slide, let's focus on the ciliate turcica. Ciliate turcica is also known as your Turk's saddle. And then your foramen ovale. Foramen ovale is where the cranial nerve number 5 passes through. Cranial nerve number 5 is also known as your trigeminal nerve. Okay, let's have the ethmoid bone. Okay, in ethmoid bone, you have your crista galli, a projection from its superior surface, and literally, crista galli is known as your cock's comb. So it is where the outermost covering of the brain attaches to. You also have your cribriform plates. These are holes on each side of the crista galli. which plays a part in uh, the sense of smell. Okay, in your facial bones, the only unpaired bones are your vomer and mandible. Let's now have maxillae. So all of the facial bones attach to maxillae except for the mandible. For that reason, they are considered to be the keystone bones of the face. Another feature of it is that it is able to hold the upper teeth, and that is due to the alveolar process. It also contains palatine processes. These processes serves as extensions of the maxillae. Now we have the structure known as your paranasal sinuses, which is prone to infection uh, in a condition known as your sinusitis. So sinusitis is an infection affecting the paranasal sinuses, which develops due to the mucosal lining of sinuses, which is continuous with that of the nose and throat. And the continuous lining of the sinus or paranasal sinus up to the nose and throat makes it um, a prone structure to infection. So infections in the nose or throat tend to migrate into the sinuses. Sign and symptoms of sinusitis include headache, jaw pain, and depends on the sinus affected. We also have the palatine bone. You have the condition known as your cleft palate. So cleft palate is the condition of the palatine bone. It is the failure, of the palatine bone to fuse, okay, during the development. You also have your zygomatic bones, lacrimal bones, which comes from the word lacrima, meaning tears. You also have nasal bones and the vomer bone. Vomer means plow. So the vomer refers to the shape of the bone, which looks like a plow. Okay. In your vomer, okay, you have the nasal septum. Septum is the one which separates the two nostrils. In your facial bones, you also have your inferior nasal concha. You have your mandible, hyoid bone. Okay, before I forget, alveolar process in your mandible, or alveoli are actually sockets. Okay, okay, hyoid bone. Your hyoid bone is not actually part of the skull. Okay, so what is its function then? It provides articulation to form a joint, and then it also houses the larynx or the voice box. Okay, let's have the vertebral column or the spine. Okay, so for easy recall of the number of vertebrae per curvature or per region, so we have the regions cervical, thoracic region, lumbar region, and then we have the sacral and coccyx. Your cervical curvature has 7 vertebrae. Thoracic has 12, Lumbar has 5. So just imagine your day. You wake up in the 7 a.m., having your lunch at 12 noon, and then ending your class at 5 p.m. Not all the time, but that's the usual case. So 7, 12, 5 bones. Okay. During the development, okay, or before birth, okay, your vertebrae is composed of 33 separate bones. So let's count. 7 plus 12, 19. 19 plus 5, 24. 24 plus 5, 29. 29 plus 4, 33. Okay. So 9 of these 33 bones, okay, fused, forming two composite bones, your coccyx and then your sacrum. So if you're going to look here, your sacral curvature or your sacrum is composed of 5 fused vertebrae, and then your coccyx is composed of 4 fused vertebrae. So your sacrum, okay, this one is the construct that uh, is inferior of the vertebrae. So the actual vertebrae is from C1 to L5. Okay. Now, of the 24 bones of your vertebral column, it is distributed into three vertebral regions that we've mentioned already: the cervical, thoracic, and lumbar. Okay. And in between these vertebra, okay, you have your intervertebral disc. Kaya nga inter, they are found in between the vertebra. So what does this disc do? These are flexible fibrocartilage which separates each vertebrae, serving as pads. So this disc somewhat like prevents the touching of two vertebrae against each other. Okay. So as a person age, the water content of this intervertebral disc, okay, decreases just like the other tissues of the body. So they tend to become harder and less compressible. Okay. So it is one of the reasons why, if you will notice, for example, your lolas, okay, as they age, they tend to have lower or decreased height. Okay. So just imagine when water um, are less each year by year, okay, and then all of them tend to um, undergo that process. Then as you age, you will decrease your height. So in elderly lang naman yun. So we have this condition known as your herniated disc. So it happens when the protruding disc presses on the spinal cord or spinal nerve and exits from the cord. Okay, so in your vertebral column, you have the disc which gives off the shape of the structure. Now, what is the use of this um, S-shaped structure? So it prevents shock to the head whenever we walk or run, and they also make the body trunk flexible. So your vertebral column has its primary and secondary curvatures. For the primary curvature, it is a spinal curvature of the thoracic and sacral regions because they are present in when we are born. So they form the C-shaped spine of the newborn baby, just like this one. So it's like C-shape, okay? But you won't see that shape at the back of an individual for an adult human, okay? That's where the secondary curvature comes in. Secondary curvature are spinal curvature of the cervical and lumbar regions because they develop somehow after birth. So it allows adults to center their body weight on our lower limbs with minimum effort. Okay, so each vertebral column has this basic um, features or markings, and these are the characteristics of these markings. Okay, so in the body, our centrum, okay, it is the disc-like weight-bearing portion of the vertebra. Okay, you also have the laminae. Okay, it is an arc formed from the joining of vertebral body. So your vertebra also has its spinous portion, which is fused or which fuses the laminae. Okay, again, spinous process fuses the laminae. So remember this: vertebrae in different regions, such as your cervical, thoracic, and lumbar of the spine, have very specific structural characteristics. So the characteristics of the vertebrae in cervical is different from the structural characteristic of your thoracic and lumbar. Okay, let's have the first one. Cervical vertebrae with seven vertebra. Okay, so from C1 to C7, it forms the neck region of the spine. Okay, so of course, again, as mentioned, they have similar characteristics except for the C1 and C2. So C1 and C2 are unique cervical vertebra. Okay, why are they unique? Because they perform function not shared to other vertebrae. Why? Because C2 holds the skull. Okay, and between these two, your C1 and C2, you have your C1 C2 joint. Okay, C1 and C2 joint allows us to rotate side to side to indicate no. So from C3 to C7, these now are your typical cervical vertebrae with similar characteristics and function. We have the so-called branched spinous process, and then the transverse known as foramina, which is the marking for cervical vertebra. When we say marking, it is the special feature of the vertebra in that region. So for cervical vertebra, you have your foramina as the special marking. So your foramina is where the vertebral arteries pass through on their way to the brain. Now let's have the thoracic vertebrae with 12 vertebra. Okay, so that stems from T1 to T12. So what makes thoracic vertebrae unique? They are the only vertebrae with articulations to the ribs. So that means when we say articulation, ribs can attach to the vertebrae, but only in thoracic vertebrae. So that's what makes uh, it unique. So in your thoracic vertebrae, you have the so-called costal facets on each of its side. Okay, these costal facets are the articulating surfaces which provides or accepts the head of the ribs attaching to it. So in your thoracic vertebrae, you have the transverse process, which articulate with the knob-like tubercles of the ribs. You have also the spinous process. The spinous process look like giraffe's head viewed from the side. Okay, so this is the spinous process. So it is a large and hooks sharply downward. So as you can imagine, it hooks downward. Okay, you also have your lumbar vertebrae, of course. Your lumbar vertebrae is a kidney bean shaped or looking vertebra. Again, kidney bean shaped. It has its spinous process that looks like a moose head in lateral view. So this is a moose, and in a lumbar vertebrae, this is the head of the moose, the spinous process. Among the vertebrae, lumbar vertebrae are the sturdiest. Why? Because they receive most of the stress. Okay, you also have the sacrum. Your sacrum articulates with the L5 or lumbar vertebrae number 5, inferiorly at the coccyx. Okay, one of the special features of your sacrum is the ala. What is ala? This one. Ala is a wing-like structure of the bone which articulates with the hip bone, forming the sacroiliac joint. So you remember that. We also have the coccyx. Okay, coccyx is actually a remnant tail of other vertebrate animal, and we also have it in us. Okay, let's now have the appendicular skeleton. So appendicular skeletons are the ones in brownish or yellowish portion of this figure, which includes your shoulder girdle, upper limbs, pelvic girdle, and lower limbs. So the bones of the shoulder girdle includes your clavicle and scapula. So we sometimes refer to this uh, shoulder girdle as your pectoral or shoulder. Okay. Okay. So one of the factors for free movement in your shoulder, that's why you are able to move it, is first is that each shoulder girdle attaches to the axial skeleton at only one point, and that is known as your sternoclavicular joint. So the drawback about your shoulder is that uh, yes, it is flexible, but it is easily dislocated, especially in children. Okay. Now, in your shoulder girdle, you have the bone clavicle. So, your clavicle provides attachment, helping to the formation of the shoulder joint. So, when the clavicle is broken, the whole shoulder region caves in medially. So, just imagine The problem is if you have a broken clavicle, since um, that's one of its function. Okay, so your clavicle functions as a brace. Okay, because of that. So your clavicle, commonly known as wings, they flare when we move our arms posteriorly. So you remember that. Scapulae. So scapulae is also known as your shoulder blade. So it has three borders that you need to remember and three angles. So in your shoulder girdle, you have your scapulae, the glenoid cavity, and suprascapular notch. Okay. You also have the acromion. Okay. So this is your acromion. What is this? It is an enlarged lateral end of the spine of the scapula. You also have the coracoid process. This one, it is a beak-like in shape which points laterally over the top of the shoulder and anchors some of the muscles of the arm. Okay, now we've mentioned about this suprascapular notch, this one. This is very important because in this notch is where the nerve passes through, or known as nerve passageway of the shoulder. So the upper limb contains 30 separate bones, which includes the following: arm, forearm, and the hand. Okay, let's have the bones of the upper limb, which is the arm. Okay, it is a single bone, which is known as your humerus, and it has slight constriction. Okay, and that is due to the anatomical neck. This is the anatomical neck. Okay, and it has two bony projections known as your greater tubercle and lesser tubercle. So these tubercles are separated by intertubercular sulcus, this one, which is distal to tubercles, is your surgical neck. This is the surgical neck. You also have your radial groove, this one. So it's not that obvious, but we have a groove here, which marks the course of radial nerve, which is important nerve of the upper limb. Okay, so in your arms, you have your trochlea and your capitulum. So both of your trochlea and capitulum are processes which articulate with bones of the forearm. So your capitulum can be outlines with a letter, and that is letter C. So this is your capitulum. So look at the outline of your capitulum. It looks like C. Okay, so your arm has depressions that are found above the trochlea anteriorly. They are flanked by the medial epicondyle, this one, and lateral epicondyle, this one. So this is the depression. Your coronoid fossa, this one, and then the olecranon fossa, this one. Now let's have the forearm. This is the arm, this is the forearm. If you're going to zoom it in, this is how it looks like, and these are its parts. Okay, So we mentioned about radius and ulna, and these are their features. Okay, so for the radius, okay, it is the it is on the thumb side of the forearm. Okay, so because they are parallel to each other, so to remember which ones is the radius or ulna, the radius is the or is on the thumb side of the forearm. So you remember that anatomical position of your radius. So your radius has a disc-shaped head, which forms joint with the capitulum of the humerus. So when the upper arm is in the anatomical position, we've discussed that, the anatomical position, it is on the little side. Okay, so radius also has bone markings just below the head, and it is known as the radial tuberosity or tendon of the muscle of the biceps attaches to at the proximal end. Let's have the hands. Okay, so it is composed of the following: carpals, metacarpals, and phalanges. Okay, so here are the characteristics of these bones in your hands. So 8 bones arranged into 2 rows irregularly. So first row, second row. Each row has 4. So 1, 2, 3, 4, 1, 2, 3, 4. So the corpus, okay, is known as your wrist. Okay, it restricts body movement or restricts movement between them. Your ligaments. So without the ligaments, the movement won't be restricted for the wrist. You also have the metacarpals. They are numbered from 1 to 5 from the thumb. So this is 1, this is the thumb, this is the thumb. So 1 to 5 from the thumb side towards the little finger. So when the fist is clenched, the hands of the metacarpals become obvious. Now, each hand has 14 phalanges or phalangeal bones. So there are 3 phalangeal bones in each finger except the thumb, which only has 2. So 1, 2, 3, or 1, 2, 3, and the same with the other 3, except for the thumb, which only has 2 phalangeal bones, 1 and 2. So that makes it 14 phalangeal bones. Okay, let's have the pelvic girdle, formed by 2 coxal bones and sacrum. Your coxal bones are also known as your hip bones. So remember that. Now your pelvis, okay, is formed by your pelvic girdle, and the pelvic girdle and the pelvis are actually 2 different terms. So you should not mix them up. So there is an attachment in the pelvic girdle, okay, which is the lumbar vertebrae number 5, okay. Also, it has sockets where the limbs firmly attaches to the girdle. Acetabulum. This is your acetabulum. This is where the ilium, ischium, and pubis fuse at. Okay, so your acetabulum is a deep socket, which means vinegar cup slash acetabulum. It receives the head of the thigh bone. So we have here um, a more visible um, parts of the pelvic girdle. So you have these parts here, ilium, ischium, and then the pubis. Ischium, and then the pubis. The three colored parts of this portion of the pelvic girdle. So your ilium, okay, so it is like a peacock's fan tail feathers. So when you put your hands on your hips, you're actually resting your hands on the ala or ali. You also have the iliac crest. It is an important anatomical landmark that is always kept in mind by those who give intramuscular injection at the buttocks. So where or what part or at which part do the health professionals do the intramuscular injection? They do it at the ends in the posterior of the superior iliac spine and anterior superior iliac spine. You also have your ischial tuberosity. So ischial tuberosity, it is a roughened area that receives body weight when you are sitting. So you need to remember that. Ischial tuberosity. Next is your ischial spine. It is superior to the ischial tuberosity, an important anatomical landmark in pregnant women. Ischial spine. Okay, it narrows the outlet of the pelvis through which the baby must pass during birth. So that means that ischial spine might also be the problem why delivery of the baby may shift from normal delivery to cesarean section. Probably the ischial spine is too narrow for the baby to pass through. Now you also have the greater sciatic notch. This one, okay? This notch allows blood vessels and large sciatic nerve to pass from the pelvis posteriorly into the thigh. Okay, so injections in the buttocks should always be given well away from this area. Okay, to avoid possible nerve damage. Again, your greater sciatic notch houses the passageway of the sciatic nerve. You also have the obturator foramen. This one. What is this obturator foramen? An opening that allows blood vessels and nerves to pass into the anterior part of the thigh. So posteriorly, greater sciatic notch. Anteriorly, obturator foramen. Okay. You also have the pubis symphysis. It is a cartilaginous joint where the pubic
Hi
bones
everyone.
articulate.
This record
Let's have the pelvis. Okay, so your pelvis has two regions, your true pelvis and your false pelvis. Your true pelvis is surrounded by bone and lies inferior to the flaring parts of the ilia and the pelvic brim. So you look at the dimensions because it is very important because they must be large enough to allow the infant's head, the largest part of the infant, to pass through during childbirth. So you have the inlet and outlet in the true pelvis. The inlet is superior opening, while the outlet is the inferior opening. Okay, so your inlet, okay, are critical parts of your pelvis, and they are carefully measured by the obstetrician. Okay, they do that to know whether the head of the infant would pass through successfully. So that's the true pelvis. How about false pelvis? Okay, it is superior to the true pelvis. It is the area medial to the flaring portions of the ilia. Okay, so we have here pelvis of a female and of a male. So they resemble the shape and size. So if you will compare, the pelvis of female have wider or are wider, and same goes to all of its proportions. Okay, and the main reason for that is for the passageway of baby. Okay, so we have here some features which makes the pelvis of a female different from that of a male. Okay, bones of the lower limb. It contains your, or it has its, the thigh, the leg, and the foot, and the bones in them. Femur. Femur is also known as the thigh bone. It is the heaviest, strongest, and longest bone of the body. So you have the intertrochanteric line, this one, and then the intercondylar elements here. So for the intertrochanteric line, okay, with the intertrochanteric crest mentioned here, with the gluteal tuberosity, this one, all serve as sites for muscle attachment. Again, intertrochanteric line, the intertrochanteric crest, this one, and greater tuberosity provides attachment for muscles. In this thigh bone, you also have the surgical neck. This one, the surgical neck of the femur is still a common fracture site, especially in old age. That is why it is named surgical neck. You also have the condyles, lateral and medial condyle, the intercondylar fossa, and patellar surface. These condyles, they articulate with the tibia below. Okay, this fossa separates the condyles posteriorly, and then the patellar surface forms a joint with patella or the kneecap. Now let's have the bones of the leg. It is composed of two bones, your tibia and fibula. Let's have the tibia, also known as your shin bone. It is the larger bone than the fibula. Okay, so they are proximally has the medial condyle and lateral condyle. So they articulate with the distal end of the femur to form the knee joint, which is separated by intercondylar eminence. This is the intercondylar eminence. Patellar ligament, also known as your kneecap. This ligament encloses the patella, which is made up of sesamoid bone. So it has its attachments. Fibula. In fibula, you have your lateral malleolus. This one. It forms part of the outer part of the ankle. Now let's have the foot. So it is composed of the tarsals, metatarsals, and phalanges, similar as that of your hands. Let's now focus on the tarsus. In tarsus forms the posterior half of the foot and is composed of 7 tarsal bones. So this is the tarsals and the bones. So body weight is carried mostly by the 2 largest tarsals, the calcaneus, this one, and or the heel bone. Calcaneus or the heel bone and talus. So talus, this one, lies superior to the calcaneus and articulates with the tibia and allows pointing of the toes. So the toes, like the fingers of the hand, each toe has 3 phalanges except the great toe. This is the great toe. So 1, 2 only. But for the rest, 1, 2, 3. Okay. Okay. So the foot has 3 strong arches, 2 of the longitudinal arches, and 1 transverse arch. Okay. So these arches are or forms the arch medially and laterally. So these are the arches, the 2 longitudinal, we have the medial and lateral, and then the transverse arch. So that's all for the skeletal system discussion. Thank you.